We are 37 days into the government shutdown, and the impacts can be felt all around Central Florida.
Hi, please don't let my kids go without food. I need my stamps. I need my benefits because they helped me throughout the whole month, and I can't leave my kids hungry.
You're listening to Engage on Central Florida Public Media. I'm Joe Mario Pedersen, in for Sharon Stone. From those shut out of SNAP benefits looking for ways to feed their families, to federally funded clinics facing closure should the shutdown continue, we speak to those around the community feeling the greatest stress related to the federal government's halting of operations. Also, DOGE cuts and provisions of the Big Beautiful Bill include cuts to federal HIV outreach and treatment programs, what that means for Orange County, where HIV diagnoses are high. And Veterans Day is next week, and we'll hear about a Central Floridian whose heroics helped change the course of World War II from the beaches of Normandy. But first, we are 37 days into the government shutdown with no end in sight. At the start of November, SNAP benefits were suspended. The Supplemental Nutrition Assistance Program is the largest federal program to combat hunger in the U.S. by providing food assistance to low-income people and families. There are about 3 million Floridians who rely on SNAP, and about 500,000 here in Central Florida. While federal judges have ordered the Trump administration to use contingency funds it has available to provide SNAP benefits, the administration says it will only pay half of what the amount would normally get, and those payments are already delayed. We spoke with Mina Alexis, a 32-year-old mother living in West Orlando. Before the shutdown, she was relying on SNAP benefits to feed her children. She shared with us the challenge of feeding multiple kids without the government's support.
So I'm just a mother of 7. I have 7 kids. So I just survived the down 3 older kids, 4 or 5, 6 of them out of 7, which is always hungry. The oldest, he is 13, and my youngest, she is 8 months. I have enough to get food on the table for my kids, but since I won't be receiving them, I've been going to local pantries and other places that's been giving food out.
May I ask you, if there was something that you really want political leaders to know about what it is that, you and your family are going through, what is something that you would want them to know?
Hi, please don't let my kids go without food. I I need my stamps. I need my SNAP benefits because they helped me throughout the whole month.
We also heard from Ivy Jones, a 53-year-old grandmother who lives in the Paramore community. Her 27-year-old daughter has 3 kids, ages 8, 6, and 1. They were also relying on SNAP. She told us she and her daughter are focused on trying to keep the kids happy and unaware of the struggle. She wants legislators to remember who they serve.
I need for them to be for the people. And that's it. If that's what they put, I don't even want them to say his name right now, because if that's what they put him in the chair to do, me personally, this is just my opinion of the whole situation. And I'm into politics, but I'm really not into politics because it aggravates me. It really aggravates me that they can just shut down the government like that and not think about the people. What about the people?
Central Florida food banks are seeing an uptick in people who are coming to them for food since SNAP benefits ran out November 1st. As residents are looking for more food options, Second Harvest Food Bank of Central Florida is expanding its school partnerships program, which feeds kids inside of local public school districts, with a new school market opening today at a Volusia County Public School. The food bank's Brianna Rebello spoke with Engage about the shutdown and the challenges families are facing.
From a school standpoint, they really see the needs of the students that they serve. They can tell the difference from when a child has food at home or when they come to school hungry, because those directly impact behavior and the ability to focus and thrive in the classroom. So they see that on a regular basis, and then they see some of these changes happening. And I think there has very much been a fear over the last few weeks from the students and families that our schools are serving. And just this exasperation from our school partners of how are we going to try to meet this increased need?
I'm really glad that you just brought that up. As far as that need goes, is there a way to quantify the wave of that need coming in the next couple of days or weeks?
Yeah. I would love to say yes, there's a perfect mathematical equation, but honestly, it depends how long things go. I did read a positive article just before hopping on this call, so I have some hope that our neighbors will experience some relief soon. But we know for a fact that SNAP is 9 times more effective than what a food bank can do. So for every one meal that a food bank provides, SNAP provides 9. And we just simply cannot fill that gap. And any cuts or pauses to the federal nutrition programs are going to impact our neighbors, and it's going to impact the demand on local food banks.
I want to ask you about a different challenge that may exacerbate this issue. And well, really, I'm wondering if it does at all. This is all happening as food prices are increasing. Does that represent a challenge for the organization as well?
For our neighbors, absolutely. And I think as more neighbors face that challenge, people maybe who've never experienced food insecurity before might be feeling the pressure of those increased prices and now turning to food banks and food pantries to try to get some relief. I think that increased or maybe new neighbors searching for help is definitely going to impact food banks.
Yeah, I could certainly see how it would. I'm wondering, you brought up the issues that lay before your neighbors, and I'm wondering what that means for Central Florida students whose families are dependent on SNAP.
Well, if you don't know where your next meal's coming from, that's already going to give you a little bit of an emotional and mental health stressor. So you're coming to school, you already have this mental load of, gosh, like I know my mom and dad or my grandpa and grandma or whoever my guardian is really stressed about money. And they're talking about, oh, what are we going to put together for dinner tonight? You're carrying that load right into class the second you walk into the school doors. So then how can we ask those students that, hey, like you really need to focus and you need to figure out how to take this test and it's really important that you behave and you listen when on their mind they're thinking about such a heavy topic. For, children, that's a lot to carry. It's a lot for an adult. But imagine, an elementary, middle, high school student carrying the weight of that. It's asking a lot.
What does this look like if the shutdown continues with no emergency provisions on, say, like Thanksgiving or the holidays?
I think there's gonna be a lot more neighbors who are lining up at 3, 4 o'clock in the morning trying to get in line for mobile distributions and, showing up that early and still being cut off, right? Because our feeding partners only have so many resources. Um, and I think as that we're already seeing, as the demand is growing, people are going out and trying to get in line to get food, but they're not able to. And so then maybe they're trying to find a different pantry or a different feeding partner, and they're having to work a lot harder to get that resource. Uh, and then you think of our neighbors who don't have that ability, they don't have the time because they're working neighbors or they don't have transportation. Um, it creates a real barrier to getting the food that's needed.
The federal shutdown is affecting programs beyond food as well. There are also tremendous health implications, too. Community health centers is a major provider of primary care in Florida. The federal funding that helps to keep it going paused when the government shut down. Now, its leaders are hoping Congress can figure things out before its reserves run low. Community health centers are in all 67 of Florida's counties and serve 1.8 million patients in Florida, according to its website. About 28% of those patients are uninsured. The Florida Association of Community Health Centers president and CEO, Jonathan Chapman, spoke with Engage about what a prolonged shutdown would mean for the healthcare center.
Jonathan, the last time that we spoke, you told us that Florida community health centers, they range in the amount of federal funds that they receive, making up about 10 to 20% of their operating revenues.
Correct.
Reserves for the rest of the year. I remember when we spoke in October, you told me that you were feeling confident to get through the shutdown through October. But if it continued to November, that's when you were going to start to worry. Can you walk me through why?
HRSA, which provides federal oversight and oversees our grant dollars, had assured us that they had reserves through the end of this calendar year, and community health centers could continue to draw upon those funds until that time. And so my earlier comments were, we've been through shutdowns before. HRSA's word thus far is very trustworthy. And so we took them at that word that there would be funds for the rest of the calendar year. So there wasn't the initial knee-jerk panic that some organizations might feel if they had not been through a shutdown before. Now, my comment about if it gets to November, we're concerned because what would be the key pain points, if you will, of either party bringing them back to the table? And if we were not able to solve it in 30 days, what made it confident that we'd be able to solve it in 60 days? And so once we get past Thanksgiving, there was a real, I guess, sense of urgency growing among community health centers, as with all the federal grantees, about the availability of those funds, of those resources come December. Now, from what we've heard, or what we're guessing, if you will, anything done to bring the government back together in the short term would simply be a very clean continuing resolution, meaning we will go back to the previous levels of funding and continue them. So it's great that people are getting back to work and the funding begins to flow and federal employees can come back to work, and TSA and our air traffic controllers can put things back in place before the holidays. At the same time, we'll still be facing a lot of those budget shortfalls that we were prior to the shutdown. We'll still be facing the marketplace extension, the enhanced premium tax credits expiring. So some of the same concerns we had a month ago are still in front of us.
The shutdown really centers around this argument about the Affordable Care Act enhanced premium tax credit, which is, of course, it's set to expire at the end of the year. Democrats want Republicans to come to the table and keep the tax credits. Republicans aren't budging so far. This issue, as you mentioned, it directly affects community health centers, directly affects healthcare. Can you explain how it affects CHC directly?
So community health centers, we treat any resident regardless of their ability to pay. So a lot of our patients were previously uninsured. Through the marketplace, through these enhanced premium tax credits, they were able to apply and receive private insurance plans. And so we received some reimbursement for those services of those patients. As we've discussed, Florida is number one in the country with 4.7 million people enrolled in the marketplace, many of which utilize these tax credit subsidies. Should those new premiums without the subsidies go forward, we've heard anything between 20% to 200 or 300% increases. And so estimating how many people might drop their private insurance through the marketplace due to rising premiums is a guess, right? But we've heard a range anywhere between 500,000 and 1 million people. Well, a lot of those are still be our patients. And so while we're struggling to stretch our resources, our operating margins are already razor thin, we're have a number of people go from a private insurance plan to uninsured, meaning we receive no reimbursement for those services. So again, our mission is there to serve those people regardless of that ability to pay. At the same time, it requires a balanced business model to make it sustainable. So again, without the extension of those credits, we'll see hundreds of thousands across Florida become uninsured.
Jonathan, I want to ask you about CHC's role in the community and the population that it serves. Could you remind us how many patients CHC serves, and as far as that service goes, how many of those patients are uninsured, and do we know how many of them use the Affordable Care Act marketplace insurance?
Sure. So we serve 1.8 million Floridians each year. About 70% of those are either uninsured or on Medicaid. So certainly low income population is a majority of those patients. Now, about 40% of that 1.8 million are on Medicaid, leaving another 20 to 30% of each community health center's population uninsured. And so again, needing that balanced payer mix requires us to serve a certain number of Medicaid and privately insured patients in order to be able to care for that uninsured.
I'm Joe Mario Pedersen, filling in for Sharon Stone here on Central Florida Public Media. This is Engage.
There's a lot going on in space, from efforts to land astronauts on the moon
and liftoff of Artemis 1
to answering the age-old question, are we alone in the universe?
Wouldn't you want to know if there was life on another planet?
Are We There Yet? Explores space exploration every Tuesday at 6:30 here on Central Florida Public Media.
You're listening to Engage on Central Florida Public Media. I'm Joe Mario Pedersen, sitting in for Sharon Stone. Ahead on the program, as Veterans Day approaches, we'll hear the story of an extraordinary Central Floridian whose heroism on D-Day helped the Allies turn the tide of World War II.
That morning, James Van Fleet was the first high-ranking officer of the American Army, 175,000 men from Canada, United States, and British. He was the first colonel on the beach.
Historian Thomas Tart shares the tale of Bartow's own General James Van Fleet. But first, HIV testing, treatment, and prevention could be facing large cuts next year. That's especially tough news for Florida, which has the third largest amount of HIV diagnoses in the country behind Texas and California, according to the Centers for Disease Control and Prevention. President Donald Trump's proposed budget included about $800 million in cuts to HIV research and prevention funding, according to KFF estimates, which includes funding started by President Donald Trump. Carl Schmid is the executive director of the HIV Hepatitis Policy Institute in Washington, D.C. He's been on the Hill speaking to legislators to ease up on the cuts. He joins us now to discuss what these cuts, should they go into effect next year, would mean for Florida. Carl, we've seen a lot of proposed cuts to HIV funding. Among them is the WRII program. I want to start there. Could you tell us, exactly what that means? What kind of cuts are we looking at?
So the WRII CARE Act has been a bipartisan program funded around $2 billion to provide not only medical care, but also the life-saving drugs that low-income people living with HIV rely on. And most of the money goes out to state health departments, and they then in turn fund clinics to make sure people can get the care that they need. It serves over 500,000 people right now, many in Florida. And, people are living. The thing is, HIV, you could live now with HIV if you have access to the care and the drugs. But, it's a lifelong commitment because there is no cure. So this funding is critically important, and it's being stretched already because, there's new people coming into the system who would need that care. And the program hasn't been growing financially from the Congress. It's been flat funded for many, many years. So the program is already stressed. And now the president proposed a small cut. But what we're really concerned about is the over $500 million that the House Republicans have proposed. That's 20% of the funding for the program. And specifically, they've gone after the funding that goes directly to clinics. So as I said, that there's funding that goes to the health departments. There's funding that goes to the cities as well. The large cities from Florida all get funding. But then there's money that goes directly. It's a lot more efficient if you just go straight to the clinics, and that pays for the doctors and the nurses and the caseworkers. And so that's what they have specifically cut, the House Republicans, over $500 million. And so clinics around the state would not be getting their funding. And, this would put people out of care. And we hope that they will not get sick. But how can I say they won't get sick if people are not getting their medical care?
Carl, you mentioned that, the much larger cuts on the proposal table here from the House, $525 million. It's about a 20% decrease. Would it be fair to say that could be kind of a death by a million cuts situation to the program?
Well, I am not thinking that way at all. I'm pleased that as I said, the President Trump, his administration seems to be supporting the program. And their cut was only like $70 million of a $2 billion program. Albeit what they cut were training programs, which is very important these days, especially when you have a limited workforce. But no, I hope that's not the situation. The Senate, I'm pleased to say, in a bipartisan fashion, has maintained the funding for the WRII program. So I think the House is in a situation where conservative Republicans are in control. They want to cut government spending, they want to cut health care, and they're looking for ways to do it. I think they know that they're never going to achieve levels of cuts like this, and that it's a way of going back to their constituents and saying, see, we tried. We cut billions of dollars, but in reality, it's never going to happen.
Carl, we're seeing other cuts to other HIV programs as well. You and I have talked before about cuts to the CDC's prevention program. Is that correct?
Yes. Unfortunately, we saw in the president's budget a proposed cut to the HIV programs at the CDC of around $800 million. Unfortunately, the House went further and they cut everything, $1 billion. And, we talked a lot about the Ryan White program and care and treatment, but how do people get into the Ryan White program, into treatment? It's through the testing programs that the CDC has, it's through the outreach programs. And most of this money, 88% of that money goes to state health departments so they can run these testing campaigns, these linkage to care programs and surveillance programs. This is an infectious disease. You need to know where the cases are so you could do prevention work. The Ryan White program by law only focuses on people living with HIV. Our goal is obviously to help them, but also to prevent new cases. And that's the role of the CDC. Unfortunately, again, the Senate has flat funded it, and the House has completely eliminated all HIV prevention funding.
I want to ask you, you mentioned that 88% of that funding goes to state departments. Could you give us a shape of what that looks like on the ground level for us? Florida is, of course, one of the top states in annual HIV diagnoses. So what does that funding translate to on the state level?
Yeah, so it's a significant amount of money. It's based on case counts. And as you said, Florida has a high number of cases, so they get more money relative to a lot of other states. They would get some of the most money. And so it goes to the state health departments. And then, they do testing programs, they do surveillance programs. But then, the way it works in Florida, it goes to the county health departments to do this work as well. And so they have their testing programs and they have their surveillance programs, and they report that information into the state, and then the state reports that into the CDC. But prevention has changed in the United States and around the world. We have new ways of preventing HIV, and one of them is PrEP, and which is really exciting. These are drugs that prevent HIV. So, you could use condoms, you could abstain from sex, but PrEP is very exciting. But again, that's the role of the CDC, the state health departments, getting the word out, getting providers educated about PrEP, getting community educated about PrEP. And you need a test, an HIV test. You have to make sure you don't have HIV to be on these drugs.
Carl, I want to ask you actually specifically about that, about the testing, because you mentioned on the county level that, of course, that's who's going out and doing that testing. And if we see cuts to that testing, as you mentioned, that county data eventually goes up the higher chain to the CDC. If we're cutting that, are we effectively blinding ourselves to what the overall shape of the problem may look like in the future?
Oh, yeah. Prevention saves lives. It also saves money. And the lifetime treatment cost of someone with HIV is $1.1 million because you have to be on the therapy for the rest of your lives. Then, of course, there's other complications too. As people get older, having HIV, it could affect, their heart, brain, other things as well. But people have other comorbidities, and it just gets more and more expensive. So it's a lot easier and cheaper to prevent HIV today, because in the future, it's not only impacting people's lives, but it's going to be more costlier to the healthcare system as well.
So right now, of course, we are still in the middle of a government shutdown with most of that argument, almost entirely all of it, being centered on healthcare. And I'm wondering, you got your ears on the Hill right now. As far as the conversations go, of course, they're centered on marketplace insurance. But I'm wondering if these cuts are being talked about on the Hill at all. What are you hearing?
You're right. There's some other big debates going on, Medicaid work requirements as well, and implementing those. And when you talk about death by 1,000 cuts, I mean, that's what we're talking about when we have all these other issues as well, and people aren't getting healthcare access. That puts more pressure on the Ryan White program. And it's the payer of last resort. My office has done around 100 Hill visits already this year. And yes, it's being talked about. People are aware of it. But I have to say, there's so many issues. There's so many new members. There's so many new staff. People don't remember who Ryan White was, for example, the young high school student with hemophilia who died of HIV and was discriminated against and couldn't go to school. And that's who the bill is named after. But people don't have a knowledge of the 80s, that people were dying because people are living today with HIV. So it's not on the front pages. So we're doing our best to get the information out, but there's a lot of other programs that are being cut as well. And then we have these larger healthcare issues, as you say, as well.
Carl Schmid is the executive director of the HIV Hepatitis Policy Institute in Washington, D.C. In 2019, the federal government began its End the HIV Epidemic initiative, which sought to reduce HIV cases by 90% by 2030. Orange County was one of 48 priority jurisdictions in the country due to its high rate of new diagnoses, which consistently outpaced the state's rate, according to the Florida Department of Health. In 2024, Orange County had the third highest rate of new HIV diagnoses in Florida, behind Miami-Dade and Broward. Local clinics and healthcare centers are bracing for the worst should the cuts go into effect. Joining us now is Ethan Suarez, the executive director of Pineapple Healthcare, a primary care practice in Orlando with a strong focus on HIV prevention and testing. We know that Orange County typically has some of the highest HIV diagnoses per year in the state, but could you describe how prevalent HIV is in Pineapple patients?
So Pineapple Healthcare, we're a primary care office, but we specialize in infectious disease, especially HIV. HIV affects everybody. We take care of everyone. So we have a good mix of prevention and treatment patients.
So these proposed cuts, particularly from the CDC, they would impact community-based HIV testing, PrEP access, and the care and treatment that you guys would be able to provide. So how would cuts in this infrastructure actually impact Pineapple's patient population?
So when this administration came into office, I worked with our board and our executive leadership to kind of insulate ourselves a little bit because I was very fearful of what this administration would do due to their rhetoric in the campaign about cutting healthcare in general. So we insulated ourselves a little bit. So the proposed cuts that the CDC is saying about removing testing services, we're going to weather the storm pretty well, if I say so myself. But some other agencies that are not more reliant on grants from the CDC are not going to weather it.
Just a few follow-up questions for you on that. In regard to those grassroots efforts that you were talking about that haven't been able to insulate themselves, when we say that it's going to impact them deeply, are we talking about them cutting employees, having less tools, shutting down their efforts altogether?
I would say all of the above. Some of these organizations are funded solely on CDC grants. If the CDC grant does dry up or is not renewed in the next year, or these grants usually run 3 to 5 years. If they decide like, hey, we're cutting the grant halfway through our grant cycle, then the program that was established for this grant may have to stop abruptly.
Are patients who access care, are they getting it through the Affordable Care Act?
We have a mix of patients that do that. We have a program at Pineapple Healthcare called My Pineapple, where we help patients get insurance through the marketplace. And we are seeing the renewals come up for open enrollment that just started 5-6 days ago, that these premiums are going to astronomically rise. And people are already coming to us saying, like, I can't afford my premium. What am I going to do? I'm living with HIV. I am on a chronic condition that needs medication daily to be able to live. And HIV is not a death sentence anymore. It is a manageable disease that is there to, you take your medication daily, we're going to live a long, happy, healthy life. But if you don't take your medication, then we're talking AIDS complications, opportunistic infections that is going to kill you within 10 years.
Wow. These patients are facing, a kind of a 1-2 punch where it feels like the impacts going on right now on the Hill are compounding them from two different sides. We're talking about, these proposed cuts in testing and prevention, but then also, as you were talking about, these concerns about hikes in ACA insurance, right?
Right. And that is that 1-2 punch. That is, you are living with a chronic condition that it's not a punishment that you are living with HIV. It is a fact that, hey, I'm living with HIV. I have a chronic condition. It's just like someone living with high blood pressure or diabetes that says, like, I'm on a long-term medication that needs to sustain my life. You have all these programs that are facing steep federal cuts from that. They are self-sustaining and they have a good job, but the job doesn't offer employer-based health insurance. So they bought a plan through the Affordable Care Act, the marketplace, and now they're saying, like, oh, well, my premium is going to jump from $200 a month to $900 a month.
Yes.
That's unaffordable.
Mm-hmm.
They need this medication that's unattainable. The medication monthly cost is over about $2,000 a month just for the medication that they need to survive. That's not including their routine doctor's visits to make sure that their blood work and their lab values are doing well.
Stigma in education, because I know that when it comes to whenever I speak to HIV groups about combating HIV, this is always what it comes down to, right? Making sure that we are destigmatizing the disease and talking to people on a more human level about it. So my question here is for you. The Trump administration has 180'd its position on funding HIV programs from their first term, right? In 2020, there was the whole goal of ending HIV, but now we're seeing all these cuts. So I'm wondering, what are you hearing from HIV patients regarding these attitudes?
It's true. Like, in Trump's first term, he created the Ending the HIV Epidemic, EHE, Ending the HIV Epidemic program that targeted specific counties, and Orange County was one of them, to give us extra funding because we were such a high risk community. That gave us extra funding to combat these growing numbers. And we saw a decline in new HIV infections because of additional funding to do outreach services, prevention services, targeting the communities that need it the most. And now we've 180'd it, and it's just very cruel in my opinion, it's just very cruel that he's just targeting these marginalized communities because it's an easy check on that community that will win his base to say that, oh, well, it's not me, it's them. And it's a very us versus them program or mentality, I would say.
Ethan, let me ask you, as far as, I guess, a hopeful outlook here. Things are not great as far as funding for these programs go, but is there anything that you are particularly hopeful for as we move forward?
As for funding, we don't know what will happen. And by the time, from our conversation right now to the next day, we don't know what's going to happen with legislation. But what we do know is that there are constantly companies such as Gilead, ViiV, these manufacturers of pharmaceuticals that are constantly working towards, new modalities for medication. We have, within the last 2 years, long-acting injectables, where a patient can come in every other month or every 6 months and just get a shot in the office and not have to worry about taking a daily medication. These new modalities for prevention and treatment are saying that we're making advancements in medicine that will eventually lead us to a cure. We've seen very early research that shows that the CRISPR model with HIV is actually removing it from the cell and not allowing it to rebind to the cell. So there are advancements that are going on, but we need the funding from the federal government. We need this investment to end the epidemic.
We heard both Ethan Suarez and Carl Schmid refer to the stigmas surrounding HIV as a challenge to providing both accurate information about the virus's transmission and the ability to secure public funding for treatment. The stigma has been presenting the same challenges since HIV/AIDS was first identified in the early 80s as it devastated gay communities across the country. It's the same stigma that caused a community to ostracize a 13-year-old student named Ryan White in Indiana, and a political antagonization of LGBTQ Americans that has been ramping up since the 80s. The Central Florida HIV Stigma Task Force is trying to flip the script.
I am not here to fit into your comfort zone. I'm here to burn down the illusions that say I couldn't be whole. Stigma tried to define me, but I redefined it. My pain didn't destroy me. It designed me. My pain didn't destroy me. It redesigned me. It sculpted my strength. It carved out the courage that now carries me forward.
That's Renee Cotto Lewis, an Orlando-based author and poet. He prefers to go by just Renee. We are at the second annual Shatter at the Stigma Poetry Slam at Three Masks Orlando, an import shop specializing in tribal masks of Africa. The store has a performance space filled with attendees, and Renee stands alone on a small, bare stage.
Healing isn't always quiet. Sometimes it's loud, unapologetic, and fully alive. You don't need permission to rise. You don't need validation to evolve. Stop waiting for them to clap. Stop waiting for them to approve your survival. You are the standing ovation. Every scar is sacred geometry. Every wound is a map to the divine.
The slam is featuring poets whose lives have been touched by HIV in one way or another. Before his performance, Renee talked about how the public narratives around HIV has remained stagnant.
We hear voices out there, but we don't hear enough diverse voices out there. And I think that, the whole media influence, particularly in the 80s, in the early 90s, really put a timestamp on what HIV was, and the stigma surrounding that. And that just has continued to carry forward.
Poet Jay Tillman spent his life living with HIV, even though he never contracted the virus himself.
So basically, I grew up in a household that had HIV/AIDS in it. So I'm just sharing the perspective of somebody who is negative, but lived in a house filled with positive people who had HIV, to let them know that, hey, it doesn't just look like one thing. It could be a mother, it could be a brother, it could be an uncle, a sibling. It's just all type of multifaceted, especially being black. And it's just, you can't talk about certain things, but in my family, we actually embraced it and we did have open dialogue about it so we can understand what that means and what that looks like and what we can and cannot do.
Tillman's mother and two brothers lived with HIV. As a non-positive member of a family dealing with the complications of life with HIV, his perspective is unique.
So the biggest stigma that I ever encountered was when I would tell people that my mom passed away from complications of the HIV/AIDS virus. They look at me and say, "Oh, you have it too?" No, I don't have it. So that was one of the stigmas. Another one was that she probably got it from a sexual intercourse. That was also another stigma. She actually got it in 1987 from a blood transfusion. Back in the day, they wasn't, checking the blood that they was having donated. So unfortunately, she needed a blood transfusion and she contracted HIV/AIDS through that blood transfusion.
For Jay, poetry isn't just performative. For someone who has lived with and around this stigma his whole life, it is cathartic.
They call it a curse, but the silence is too. Labeled by whispers, denied as a truth. They call you incurable, unforgettable, untouchable. But I call you out tonight. I've seen you before. You entered her body and dropped her off with death at our front door. You hid quietly until 1994. Most still never mention you in rooms that I already know you in. You hear the infamous burden, twin. You set people up for the L, but HIV, I can't let you win. This is a reverse Uno, baby. Time for your death sentence to begin.
Public policy regarding HIV prevention and treatment is often dictated by the whims of these stigmas. Anthony McNeil is a peer support specialist with the Central Florida Multicultural Wellness Center in Winter Park, and he is the organizer of this poetry slam. He sees recent cuts in funding of HIV treatment and prevention as a symbol of outdated cultural attitudes.
Right now, a lot of the grants for HIV testing have been taken away, so we can't get compensated to do HIV testing. And HIV testing is a very strenuous job. As much as we would love to work for free, we need resources, we need materials. Right now, we were getting condoms from the health department for free. Now we have to pay for them. That's a big deal. HIV tests are very expensive. If you go to the store, they're $50 a pop. But we were giving them away so people can get tested, know their status, but now we're having to pay for them. That's a big deal. And then by them cutting millions of dollars towards prevention, it's only going to make it that much harder.
Back on the stage, poet Shayna Castano, who writes under the name Simba, is delivering a passionate plea, asking for guidance on how to tell people she cares for that she is HIV positive.
How do you tell someone on the first date you have HIV? Do you tell them at all? Or do you keep it a whisper? Do you just pray the disease will fade away by day 2, or do you wait until he invites you to come back to his place to reveal the news?
The audience responds with hoots of support and the customary finger snaps that you only find at poetry readings. McNeil talks about what he hopes the attendees take away from the event.
I hope that people's eyes continue to be opened. I think whenever I say I'm using art to talk about HIV, I feel like some kind of a light goes on, and then I kind of gain their attention. If there's a way that I can continue to gain the attention and keep the attention, then I think that we'll continue to break barriers. We have to start somewhere.
Coming up, in commemoration of Veterans Day on Tuesday, we'll hear the story of a heroic Central Floridian whose service on D-Day helped change the course of World War II. You're listening to Engage on Central Florida Public Media.
The Wrap is a podcast from Central Florida Public Media, curating the top Central Florida news stories and in-depth reporting each week. Join me, Brendan Byrne, as I bring you news headlines, deep reporting dives, and insightful conversations from the news team. A new episode of The Wrap every Friday morning. Get it wherever you get your podcasts.
You're listening to Engage on Central Florida Public Media. I'm Joe Mario Pedersen, sitting in for Sharon Stone. The General James Van Fleet State Trail is a 29-mile-long hike crossing 3 Central Florida counties from Polk City south to Mabel in Sumter County. The trail is named for a legendary native of Bartow. James Van Fleet served in the Army in World Wars I and II, and later in Korea. He's best known for his heroic leadership during D-Day, the Allied landings on the beaches of Normandy that began the offensive that led to the defeat of Nazi Germany. James Van Fleet and other Central Florida heroes of D-Day will be the topic of discussion tomorrow at the Orange County Regional History Center. At noon, historian and fifth-generation Floridian Thomas Tart will share the stories of the Central Floridians who helped lead the Allied forces to victory on that June day in 1941. Tart joins Engage to share the story of Bartow's own James Van Fleet. And Thomas, you'll be discussing World War II heroes from Central Florida, but I'd like to focus on one in particular, James Van Fleet, who grew up in Bartow. Could you tell me more?
Yes, we didn't have any high schools back in the 20s of any site. So the fellow who was a hero in Orlando, Jacob Sumlin, who gave us Lake Eola and moved to Bartow to open up his cattle operations, he started Sumlin Institute, which today is Bartow High School. James Van Fleet went to school there and graduated from Sumlin Institute and went to the United States Army Academy at West Point. He graduated in 1915. And he was the star fullback for the Academy. And on his team was Dwight Eisenhower from Kansas.
Some big playmakers there.
Yes.
So he served in World War I. I believe he was wounded on his return while still serving as a senior officer in the University of Florida's ROTC program. Could you tell me more about that experience?
Well, this is a great story. He had been in World War I. After the war, he was head of ROTC at the University of Florida, 1923-24. The football coach that preceded him was terrible. So the president came to Major Van Fleet and said, look, you were a star football player at Army. Will you coach the Gator team? And for 2 years, he was head of ROTC and the head coach for my alma mater, the University of Florida. And if you look up his record, 8-1 won 1 year, 8, 1 loss, 1 tie. Second year, 8-2. He had the greatest percentage of winning to the University of Florida until my teammate Steve Spurrier comes along and breaks that record. Now, fast forward to D-Day. We had 2 beaches, Omaha and Utah, 7 miles from Omaha to Utah. That morning, James Van Fleet was the first high-ranking officer of the American Army, 175,000 men from Canada, United States, and British. He was the first colonel on the beach. Being a West Pointer, he looked at the situation, and because coming in, one of the lead boats had hit a mine and sunk, they took him to the wrong beach. So he missed where he was supposed to land and planned on Utah Beach by a mile. But being a bright colonel, he listened for the gunfire. And behind the Utah Beach he was on, he didn't hear German machine guns, the M43s. He heard American paratroopers' carbines. And he knew that the 82nd and 101st, who had parachuted in that night, were holding 2 causeways over the flooded plain to get his army off of Utah Beach. About this time, Teddy Roosevelt's son, Teddy Roosevelt Jr., the oldest commander at D-Day, the 1-star, comes up and said, "Colonel Van Fleet, what we got?" He said, "General, we got good and bad news. Give me the bad news first. General, we landed at the wrong darn beach. We're a mile south of where we landed." "Well, then give me the good news." Guess what? Those boys in the 9th Air Force who came down the beach at 400 feet, twin-engine bomber, have knocked out many of the guns. And secondly, our paratroopers who parachuted all over in the night are holding 2 causeways to get our men inland to block the Germans from coming from their port, Cherbourg. Roosevelt first says, and Roosevelt's on a cane. He had to get permission from the president to go because he was the oldest general to land. He says, "I got to notify Bradley out on the cruiser Augusta to bring the second wave up to the original Omaha Beach." And Van Fleet says, "Excuse me, General, this is the place. We hit a soft spot." And that's when Roosevelt makes the famous statement, "We're going to start the war here and now."
I want to push forward, Thomas, to after the war. This was far from the end of his military career. He continued his command of the 8th Infantry in Korea, and I believe developed a lifelong relationship with the Koreans. Could you tell us more about that?
Yes, he was sent in as one of our Army commanders. And of course, the hero of the Philippines, Douglas MacArthur, was the commanding general. Douglas MacArthur was told, don't go above the 39th parallel above Seoul, because then you're going to bring the Chinese into the Korean War, and we got a World War III. He flew all the way out to meet on an island, and he talked to Douglas MacArthur, and he said, "Look, this is very important. You cannot cross the Yalu River and get into North Korea because we got a situation. You understand me?" "Yes, I do." What did MacArthur do? He broke that rule and went over. He fires the hero of America, Douglas MacArthur, Medal of Honor winner, fought in World War I, hero to the Philippines, World War II, and now he's firing him in Korea. Well, guess what? Who does he appoint to be in charge of the American Army in Korea to move up to that 39th parallel and stop? You got it, James Van Fleet from Bartow. At the end of the war, Truman is interviewed. Who was your best commander? He said, without a doubt, James Van Fleet. Do you know what President Truman did for him? The war ended. President Truman sends Air Force One from Washington, D.C. across the Pacific to Japan, loads up General Van Fleet, then 4-star General Van Fleet, and flies him back to Bartow. When word got out that the hero of Polk County, James Van Fleet, was coming home, the whole town showed up for his arrival. Now, when does the president send Air Force One to get anybody of this statute, Harry Truman did it. He lives there on a ranch between I-4. On I-4, if you go down towards Lakeland, you used to see an airplane on the right. Van Fleet had a ranch. When they built I-4, he said, I don't want any money. I just need somewhere to feed my cattle. Between Daytona and the end of it in St. Pete, there's only one dirt road under I-4, and that's Van Fleet's cattle trail to feed his cattle. Later, he died, and he is buried in Arlington Cemetery there with his second wife. His first wife had died. He's buried as an American hero in Arlington Cemetery.
Thomas Tart is a historian and fifth-generation Floridian. He will be at the Orange County Regional Historical Center tomorrow at noon to talk about the role of James Van Fleet and other Floridians in achieving victory on D-Day. We'll have links on our website, cfpublic.org. That's all for today's edition of Engage. Join us next Thursday for a special roundtable discussion about gun violence and the state's Stand Your Ground law. I'm Joe Mario Pedersen, sitting in for Sharon Stone. Thank you for joining us. All Things Considered is coming up following NPR News.